Hello, I'm Phil.
Hi, I'm Esther.
So today we are going to talk about the Achilles tendon and all the problems that can go wrong with it. So, Esther, what's the Achilles tendon?
So the Achilles tendon is made up of two of your calf muscles, the gastrocnemius and soleus, and they all combine and insert onto the heel bone.
Yeah, so down at the back of the heel, yeah.
Yes.
And it's quite a big tendon, right?
It is.
Yeah.
Yes, it is very big.
And it's the one, if you didn't have it, you wouldn't be able to walk because you
That's
can't,
right.
you can't move forwards, you can't push off your foot. So,
Yeah.
So that tendon, obviously people have probably heard of the Achilles tendon and probably heard of another term called Achilles Tendinitis or Tendinopathy. So what is Achilles tendinopathy?
Right. So Achilles tendinitis or tendinopathy is basically inflammation of the Achilles tendon. So you can get inflammation like around the mid portion of the Achilles tendon there. Sometimes people can get it on the insertion or further up the Achilles tendon there.
Lots of different spots it can sort of can affect. Yeah.
Yes.
And that inflammation is what sort of hurts in it. And there's that sort of acute, there's a couple of different versions of it. And I think that's probably important for people to understand as well. There's a short-term version and a long-term version. So the short-term version is often, an example would be like a 15-year-old that does a big basketball carnival, plays 7 games over 2 days, and they come away with a tendon that's a bit sore. So that's what we call sort of acute and reactive. But then you can get the one where, and I'll see if I've got a photo, sort of see this here, it's sort of very thickened, and that's taken years to develop in lots of people. So it's that chronic, degenerative, cranky tendon. So, and I know that we see both versions of that quite often.
We do,
So if we're dealing with someone with Achilles tendinopathy, Esther, what kind of things do you look for? So from a biomechanical point of view, which is the way the body moves, what do you often see in people with Achilles problems?
All right, so the problems that I often see, or features that I see in the way that they walk, and also the way that their foot posture is that their heels tend to splay out quite a bit. So we'll see at the back the photo there. So it's sort of like on an angle there. So ideally we will like the foot to be a little bit more in neutral, a bit straighter. But when it has that effect, when the heel does splay out like that, it does cause quite a bit of an effect on the Achilles tendon.
It really doesn't like it, does it? It pulls.
No, it doesn't.
It sort of pulls in a, as you were saying before, a different sort of direction, a direction you don't really want it to be pulling. And it does take quite a while to develop. So it might start as just a little bit of swelling, a little bit of pain in this area, but over time it will thicken up and really can become quite debilitating. People can't do what they need to do, and work, exercise becomes miserable.
Yeah, it does.
So treatment options. So often people who've had this, they've usually Googled it or seen a doctor or the physio and done some exercises, stretches, heel raises, and if that's worked, we don't usually see them because it's worked. But often we'll get people once they've tried the normal stuff and it hasn't helped. So what's the sort of things, I mean, you and I will both give ideas, but what's something that you would do if you saw this situation with a patient?
So the first thing I probably would try to do is to strap the foot, just to basically give it the support that it needs. That's more of a short-term solution though. So medium to long-term solution would be orthotic therapy, so inserts that go into your shoes, and basically that's to control and support what the heel is doing as well. So if we can prevent tissue stress on that tendon, it's not going to be as cranky and it's going to be able to heal better.
Even within a couple of days, people could say, "Oh, it's feeling so much better with that extra support."
That's right.
And we know if it responds well to that taping, it's going to respond well to an orthotic in your shoes, your work shoes or joggers or whatever. Now there's another. I'm going to talk about another couple of treatment options because one of the tricks we have. What we have is when we get a chronic degenerated tendon, it just doesn't want to get better. It just bulked and it won't move on where it should. And we'll often use some of the fancier sort of tools that we have. We have a shockwave machine. Now, it sounds very scary, but it's not. It's just, it's a machine that delivers a high energy acoustic pulse into the tissues, and there's great evidence for use on the Achilles tendon. It just works so well for that problem. It had many people who've had this pain for years, 2, 3, 4 years, where they've had a great response. Even within a couple of months, they've seeing a huge reduction in the swelling and a huge reduction in their actual functional pain. So that's something we use. And we have another newer tool as well, which is a low-level laser, which is fantastic again for inflammation. It just helps to get things moving on and healing a lot faster. So we have lots of things we can do. Yes. And it's great. I mean, the thing that we love is to be able to get people that have had a problem that's been affecting them for months or years, and we love to get them feeling better and back to doing the things that they used to do. So it's no fun if you can't do the things you want to do, exercise and all the things you need to do, like go to work and you know, do the things you need to do. So so again, if like we say at the end of all our videos, if you are listening to what we're saying and thinking that sounds a lot like me, that sounds like the problems I have, then we'd love to meet you. You can give us a call, if that's the easiest way, or if you're watching this after hours, you can just jump online, our appointment availabilities. We've definitely got some today and tomorrow, so yeah, you can definitely get in really quickly to see us. Either me, Esther, or our other 3 podiatrists. And yeah, we'd love to see you back doing the things you want to do as soon as possible. Well, thank you for watching.
Thanks, guys.
Bye.
Bye.